Hello, my name is Fatmata and my student ID is N41370840. And my lecturer is Mr. Tijoke Agomo. And I'm going to be presenting a bit about introducing and giving a main body and summarizing about the impact of COVID-19 in the mental health service, because I choose mental health service in health and social care. So I'm going to be doing introductions. These presentations help to analyze how COVID-19 impacted on the mental health of people and increase the demand of mental service in health and social care. Mental health service provide help to treat mental illness, behavior disorder, and emotional issues. So on the slide one, I have put learning outcome one, which an explanations and an explorations and an explanations of contemporary issue waiting national context. As we all know, during COVID-19, many people experience anxiety, depressions, and substance use disorder, according to WHO in 2022. Among all kind of essential service, mental, neurological, and substance use conditions were the most affected and the most directed during COVID-19 period. It increased the use of social media, reducing physical bonds, like people were not allowed to visit each other, even families were not allowed to visit each other, and friends were not allowed to visit each other. People were asked to stay at home and not to go out unless if they're going to do exercise or if they're going to fetch for food and medicine. So it's increased the loneliness, increased the demand of mental health service as per APA 2023. Most of the COVID-19 practitioners accept the fact that an increase in demand for anxiety and depression treatment increased a lot for people. People were depressed because they were not allowed to go out. While every human being got used to stay at home, got used to go out anytime they want without telling anybody that they are going out. Now, in just one day, everybody were asked to stay at home, not to go out at all time unless they're going to fetch for food or medicine or exercise. So that leads to many people to have depressions or anxiety. So it's also in the third year in a row, while demand for treatment for trauma and stress disorder and substance use disorder also increase. And also some people were facing domestic violence in houses where some people were not allowed to express themselves. So, and if we go to slide 4, which is some stakeholders, such as patients, caregivers, family members, advocacy organizations, and policy makers, need to actively involve in the contemporary issue to influence service improvement. They can influence service providers practices, increase funding. They need to increase funding to help bring a positive impact in the society. The UK government and also need to reform and improve the Mental Health Act 2022, where on the services 117 council members and the NHS need to offer aftercare service. They need to offer aftercare service to people, so they can have somebody who to bring them home and take them back to the hospital until they get better, and so they can go back to their regular life. So continuing to slide 5, I'm going to be talking a bit about media portrayal focus was also overwhelmed, an overwhelmed surface, highly the trend of telehealth and the proportionate impact on people. News channel and social media highlight their urgent demand of funding and change to manage the escalations issue. Regulatory bodies help to protect mental health service consumers from any kind of health risk and ensure a safety working environment for healthcare workers. So I'm done with almost learning outcome 1. So I'm going to be answering a bit about learning outcome 2, which is increase the health service demand during COVID-19, the mental health demand, because most of people started to live in isolations and not to go get a chance to meet their family, as I said at the beginning of the learning outcome 1. So they were not able to meet families and friends, which increased the health related issue, which increased the overburden it's continuously now increased the mental health issues, and it's continuously increased the mental health issues. The absence the mental health related issue, the overburden continuously increase professional in this field and also impact on the quality of care, unrealistic expectations from patients, long working hours for healthcare workers, any breaks, and poor communications also among other healthcare professionals also increase the pressure on them and make them really overwhelmed with patients coming in every day, and the shortage of beds. There wasn't enough bed for patients. So also on slide 7 is absence of proficient mental health service professional. Definitely reduce the quality of care, increase longer waiting time, and changes experience worsening conditions are also high during those delays. On using telehealth in mental health service during and after COVID bring a huge changes in health and social care, such as offering virtual visits and reducing the need of to wait outside of hospitals. Okay, I'm still continuing to learning outcome. So I'm going to be continuing to learning outcome 1, and it has also noticed that some marginalized group often face discriminations and are prevented from awaiting the mental health service. So in that case, there was many people that was facing discrimination, such as Black people or Black ethnic minority people. The diversity wasn't really respected at that time. People were treated differently. So they need, for example, for ethnic minority people, also people with disability, and members of the LGBTQ plus community are more likely to experience difficulties in receiving mental health service. It also says mental health service providers nowadays experience many financial constraints and resources allocations that are mostly influenced by COVID-19 having limited funds. Also include issues like poor staffing, not being able to expand their service, maintaining their infrastructure and all. So that's what I have to say about learning outcome. Now I'm going to be moving on to learning outcome 3 quickly, which is potential outcome and recommendations. Completing the resource help to meet some specific outcomes, such as ensuring all people, including poor and marginalized ones, receive better access. It means that in these situations, it means treating people equally, no matter what they are, or who they be, or what they believe, treating them equally, no matter their racial or color, ethnic background, just treating them equally and giving them better service, just as same as others. So, and also this study also helped to reduce the overburden on mental health professionals that developed during and after COVID. I'm still continuing on slide 10. The mental healthcare professionals need to invest in telehealth platform to ensure people from any point easily access mental health service. It's need to hire more talented people. So the mental health service need to hire more talented people and to abolish stigma, to try and mostly convince people with mental health that maybe impact them during COVID to be able to express themselves and to be received in a very appropriate manner so they can express themselves, and their disclosure need to be kept confidential. So they need very talented people in this sector to manage the growing demand of workloaded, because it's really a workloaded. So yes, it would be effective to introduce a mental health awareness campaign at a national level to increase people's knowledge and acceptance, and to abolish stigma. The government and stakeholders must also, the government and stakeholders must also the government and stakeholders must also allocate additional funds to provide mental health services for all, and make sure everybody is being treated equally. So moving on to the conclusions, I'm going to be concluding all that I have been given here. So in conclusion, it can be said that by implementing these recommendations, it would become easy for the mental health sectors to improve their service so that people can easily access efficient care, and it would be more easy to treat people equally, no matter their colors, background, or beliefs. Thank you so much.